Hello, everyone. My presentation is on the expansion of a mental health program policy in high schools. My name is Destiny Webster, and this is my presentation. So, first and foremost, we need to talk about why mental health is such an issue. Um, and I kind of want to give you guys just a brief explanation as to why this issue is so important to me. So, as we know, mental health issues has been a serious issue for years now, and specifically in teens. Now, there are many factors as to why the mental, physical, and emotional well being of teens are being affected. Now, I kind of want to include some factors being bullying, disruptive behavior, depression, anxiety, stress, trauma, abuse, their home environment, developmental changes, meaning, their identity and how they physically see themselves, school issues, and I think another big one is social media. And, sometimes if the behaviors get worse, this can lead to suicide. Teen suicide is the third leading cause of death for young people of 15 to 24 years old. Also, 18% to 31% of children have experienced bullying at school. So, as we can see, bullying is kind of one of the main reasons as to why many teens have issues, and also those other factors that I talked about. Also, we can look at the pandemic as a big issue as to why many students, function differently. According to the Kaiser Family Foundation, more than 25% of high school students reported worsened emotional and cognitive health. And this definitely has to do with being in the house, not really having an outlet to really go to or many things to do and to communicate with people. So I can definitely see as to why that has affected many teens. So why is this important to me? Well, I suffer from mental health issues, and I know people who do, but also this is an expansion of an educational program that promotes mental health awareness in schools and the appropriate use of programs in schools, encouraging social and emotional abilities while strengthening positive behaviors. It is also an opportunity for schools to innovate and effectively treat behaviors immediately, just so, we won't have all these cases of suicide. But also, it decreases the burden on staff, which is very important, because most of the staff are dealing with the issues of these teens. So, moving on, I wanted to look at the mental health policies that have been enacted or introduced in the United States as a whole, but also the policy in Connecticut. So, the first policy, the National Mental Health Act of 1946, actually introduced the National Institute of Mental Health. Now, this act was focusing on the research aspects of mental health behaviors and why people were acting certain ways, just so their behaviors could be understood and look for new ways to improve mental health. Following that, the New Freedom Commission on the Mental Health Act of 2002 was signed by President George W. Bush, and it was looking to examine and improve the mental health of children and adults through studies, just like the National Mental Health Act of 1946. Okay, why is this happening? Why are these children and adults acting this way? Also, to improve the delivery of mental health services. Also, the Mental Health in Schools Act of 2015 was introduced to Congress to provide funding and expand the school safety program to increase access for school services, staff development, and training for kids with mental health issues. I haven't really heard anything more about that, but I think that's really important as well. Following that, the 21st Century Cares Act of 2016 was signed by President Obama following the shooting in Newtown, Connecticut at Sandy Hook, which was a very sad and unfortunate situation. Um, this bill focused on providing grants to improve mental health services, um, which, that involves little kids. So I think that act was definitely important. So, those kids can get the services that they need after a traumatic event. And recently, the Mental Health Services for Students Act of 2020 was passed by the House, and it included the support of school based mental health services for children and adolescents in schools and communities. So hopefully, we can see that law be signed in the near future. So, I want to talk about the Connecticut Bill HB 6509. So, this bill um, improved communities and schools with school-based mental health clinics so students can improve their behavioral issues. So I'm going to go more in depth about this bill and kind of give you guys an idea as to why I want to expand it or amend it with my own policy idea. So moving on to my mental health healthcare policy. So this policy, as I stated before, is looking to amend the Connecticut State Legislature Bill HB 6509. Under Section 2, it states that schools can make counseling available by a licensed professional, either a therapist or a psychologist, for students, families, or groups. However, looking into this, if we know teens, what teen is going to openly discuss their issues if they're not going to feel comfortable or they're feeling forced to? So, my idea is to incorporate an educational program for students who are interested in partaking and sharing their issues or experiences when they are comfortable to do so. It allows them to have more control of their emotions, of their life without feeling forced. So, within this policy, I kind of wanted to just focus on, what do teens like to do? What excites them? So, balancing treatments, sports, arts, music, dance. Most teens are doing sports and dancing, or they're playing music, or they're playing an instrument. So that will get them to really focus on that aspect, and it can improve, how they see things in life and how they interact with people. Also, individual or group support sessions and support from mental health advocates who minister speeches and lectures. I think that's important to hear from someone who suffers from a mental health issue and what they did to, help themselves. So a study was done in New Haven, Connecticut, utilizing school-based programs where they saw an increase in behaviors. 4,584 students visited a school-based health center within a 2-year span. And then many of the visits range from mental health issues to physical issues. So the proponents include the Connecticut Education Association, National Institute of Health, American Psychological Association, the Department of Children and Families, Department of Public Health, the Connecticut Association of School-Based Health Centers. Now, these associations, want to progress the mental health needs of students, to provide them with a program that will assist them in getting help and, maintaining their behaviors and becoming a better individual. The opponents include representatives that criticize this idea because, they didn't want the assessment of adolescents' behaviors without the parents' consent. So the specific stakeholders involved include the Connecticut teachers, schools and high school students, National Alliance on Mental Illness, the Connecticut Education Association, the Connecticut Association of Boards of Education, Mental Health Connecticut, and the Connecticut State Department of Education. So these stakeholders would actually be amazing for this policy because, one, they're focusing on education. What is important in schools, and what are we going to innovate to make schools better and make our students better and to help them with their issues, because, that really affects how a school runs, and, how kids do their homework, and, you know, the overall well being of the student makes the school. So I thought these stakeholders would be awesome for advocacy. So advocacy strategies include integration of a school-based mental health program. It's important that these teens have a safe space to share. Um, Also, the use of social media. All, if not majority of teens have social media, so it gets the word out there. Um, ask what the consumer needs, their wants, not what you think is best for them. It's important to listen to the consumer. Okay, why are you feeling this way? What can we do to help you? What is going to make you feel better? Not give them an idea that you think is perfect that may not work for them. Also, feel a sense of belonging. It gives a reduction of stigma and isolation. So, many people may feel judged for having an issue, but it's okay, and it's okay to receive help. So, my further innovative recommendations include staff and students advocate for mental health programs in schools, educate students on their mental health issues, educate parents on their children's mental health and the program offered at their schools. Also, teach students on effective behaviors and healthy coping mechanisms. In addition, discuss the educational program to high schools in Connecticut and meet with staff and educational boards for advocacy. I also want to include that, like I stated before, the whole isolation and stigma and the judging. A lot of kids may feel scared to open up because they feel like, okay, there's something wrong with me. Why do I feel like this? But it's okay. It will always be okay, because a lot of people have things you know, that are going on in their life. But it's okay to receive help, and it's okay to not be okay. So, yeah, this is my presentation, and I hope you guys enjoyed it.